Um, Okay. Um, so also kind of a heads up, because of the schedules of our guests, we're going to kind of shake up the agenda. So here are the things on this slide that we intend to cover today, just probably not in that order. Um, but you know, June is Oral Health Care Month or Oral Health Month. And so it's wonderful. I think that we're able to have some folks on the line to talk about dental care for veterans because dental care is health care. And I think there are numerous reports out there that show that good oral health um, contributes to just overall well-being of an individual and their overall health. Um, so when it comes to the agenda, what we're looking at doing is Kyle Arneson of Objective Veteran Smile is here to talk about his organization. And because of his time limitations, we're going to let him talk about his organization. Then we're going to jump into the round robins and the updates from the hospital and from WDVA, and I think maybe from the CVSOs. And then we'll jump back into the dental care topic with Jeff Darby, who's already on the line from the Wisconsin Department of Veterans Affairs. And we're also planning to have Dr. Sabino from the hospital. Now, Dr. Sabino also has some scheduling conflicts. So she may be able to just pop in for a little bit. So if we're in the middle of the round robin updates, I told her that we would accommodate her just as she's available to pop in. So we're going to be kind of all over the place. Um, but just more on the dental health and talking about dental health before I turn it over to Kyle. Just recently, I think it was just the other day, I read Military Times had an article about, and it was profiling some of the challenges that veterans experience in obtaining dental health care. And it just is a reminder that the VA is not the provider of everything for every veteran. And even when a veteran qualifies for VA care, or is eligible for VA care, there can be stumbling blocks or roadblocks in the delivery of that care, depending on where that veteran is, what their rating is, what they're rated for, a number of factors. So I think, this is such an important topic, and why we felt that, it is important to raise awareness across our community and with our community providers. So with that, I am going to turn it over to Kyle. I'm going to stop sharing my screen. But Kyle, go ahead and tell us about Objective Veteran Smile.
It's an objective, not an operation, right, Kathy? Hey, I really appreciate it. Thank you for having me and appreciate the accommodation on schedule wise. Hey, we all got to get comfortable with being uncomfortable. That's what makes it fun. I can probably do this in about 7-8 minutes. And for questions out there, let's face it, it's a massive project. I'm Kyle Arneson. I'm a Marine Corps veteran. My family's been in the Madison area, I guess, since about 1840. They got off the Irish boat, started planting corn and soybeans. My great-grandfather thought it'd be a good idea to walk with 3 buddies of his from Janesville to Camp Randall and sign up for the Union Army in 1863. And that started our military lineage. Thank God he made it back from the fighting, and we're on 7th generation of an ag operation down that way. My dad and his 4 brothers, all are combat veterans from Korea. They came back, started businesses. I'm a Marine Corps heir. I was a commodities trader for many years, built a number of different businesses. So I like to say I just keep failing forward. I've never really had a job. But I am a Marine. I do have teeth. And seeing this inequity a few years ago, I just said, well, like anybody else, I'm sure somebody's doing something about it. That can't be true that the vast majority of us veterans are not covered by the VA healthcare system in dental care. So you put that off for this is about 5 years ago. Put it off for about a year through another couple of thinking partners. We had a veterans entrepreneur group. Maybe some of you had seen something that we stood up here in Madison from and national group Bunker Labs, veteran entrepreneurs and some thinking partners there for business owners. So we were thinking into that about 4 years ago, and a couple of the other veterans there said, "Well, I don't see anybody doing anything. Do you?" I said, "I don't." So if not us, then who? If not now, then when? Bottom line is, when you look at the VA healthcare system, decent, certainly not perfect, obviously. But the reality is, with that piece of the dental care, the lack of dental care options, the fact that you need to be 100% service connected disabled before you can qualify here in Madison at that beautiful fifth floor dental clinic. It's just unacceptable, especially when you start to see so many of our Vietnam era veterans and ad nauseum what happened to those folks when they raised their right hand and swore the oath and went in, came out, and so many are 60, 70, 80, 90% disabled, and they still can't have something done about their oral health care at the VA. Again, unacceptable. Instead of bitching about it, excuse my language, that's just kind of who I am. My most effective message, I guess, is the one you live. I think I'm doing that, but it is unacceptable. I didn't know what we were going to do. I don't know a damn thing about dentistry, but I knew some people who did. And asking them about 4 years ago, they also did not know that this was an issue, as do most people. They don't know that veterans, oh, I thought you guys have the VA. Well, we do, decent healthcare system, but it's unavailable for most of us for dental care. Bottom line was, we put some money together and just told a few veterans that we had dental care options, and we're swamped. We had hundreds of veterans from around the state of Wisconsin. I'm based here in Madison, and we just put that out to a couple of CVSOs in Green Bay and Madison area, and we were just swamped with waiting lists. And again, what we were doing was just a local dentist here and up in Green Bay. Hey, if you put a veteran in my chair, he's got X problem. I do the work. You'll pay the invoice. Yes, we will. Well, we went through about $1 million pretty quickly that way and just had to pause the program. Let me fast forward, because this is where the great stuff is. And while it seems to be an issue, it seems to be a pretty big thing to disrupt government healthcare. How hard could that be? We're doing it. We're doing it privately, and it's a model that's now sustainable and scalable. I was introduced to Delta Dental, the big benefits company around the country, but certainly in Wisconsin, they own maybe 90% of all the back end benefits, particularly for dental care. We met about a year and a half ago. They could not believe this was an issue, and they said, "Well, not that we don't believe you. We'll check it out. I'm sure we'll believe you," but they couldn't believe it because they own the Department of Corrections contract for the state of Wisconsin. So if you're incarcerated in the state, you've got their gold dental package for benefits for dental. And that's, again, just adding salt to the wound. Bottom line is, they said, let's take a look at this. They worked for 6 months. Here's what we've got. Delta Dental, the big provider, they underwrote a dental insurance policy. Now, again, I want to be clear. This has never been done. It's never been done, and that's okay. It's being done now. It's never been done, certainly not in the state of Wisconsin, but in the country. What they did, because we're a Wisconsin nonprofit, what they did is they underwrote a dental insurance policy. So we now look just like any other employer in Wisconsin or anywhere else in the country, that whether you're a 20-year-old veteran or a 90-year-old veteran, anywhere in between, we have a basic dental care insurance policy through Delta and their 5,500 dentists statewide, that for $25 a month, $300 a year, we as the nonprofit pay that dental insurance premium for the Wisconsin veteran. All we ask is an honorable discharge. So we can do this now in all 72 counties, 11 sovereign nations. We want to know if there's a veteran in need of dental care, we want them in this program, we want this enrolled in this program, and there is no cost to them. Well, if you start adding up numbers, that certainly means there's going to need to be a lot of money coming into the system here, into the company, into the nonprofit. At $300 a year, You do the math. 10 veterans are 3,000, 100 veterans is 30,000, et cetera, et cetera. We've got tens of thousands of veterans, I believe, out of our 417,000 veterans in the state that need the dental care piece, that they're in a gap or they're over 65. The Medicare doesn't cover it. Or we've got a nice relationship with the Student Veterans of America here at University of Wisconsin and some of the other systems. Those men and women have come out of the military. They're not working yet. They're not covered by benefits. There's a gap there. And oh, I'm good because I'm young. Well, you're good until you break a tooth and it's a $3,000 crown that's needed, and it's worse than any car repair. So we've got a basic dental care insurance policy underwritten through Delta that we pay $300 a month. So it's $300 a month, $300 a year to sponsor Wisconsin veterans basic dental care. And while at this time we don't cover crowns, dentures, bridges, some of the expensive stuff, as Delta said when we began this, we soft launched it here in January of this year and starting to get veterans into the program. Certainly want to put that out and not keep it a secret. But as Delta said, start with the basic dental care program. Just like any other company, you start with this, you'll cover 80% of the people that are your members, employees, if you will. And as you get more funding in, we could certainly flip a switch. Hey, now we cover crowns on this, and the policy is not 25 a month; it's $29.50 a month, or whatever the numbers. Bottom line is, we've got the program. It's never been done. We're looking to not keep it a secret. We're absolutely having a direct impact on Wisconsin veterans' quality of life. When again, I'm a veteran. I have teeth. I don't know a damn thing about dentistry, but I do know that when you start to have oral health issues, no matter if you're a veteran or not, that is something that is a real issue. And then you can certainly make a small bridge. I've been told by practitioners over to mental health, et cetera, et cetera. Hey, I'm not feeling good about job interviews. I'm not feeling good about relationships, et cetera. So that's our program, Objective Veteran Smile. We've got certainly PDFs of our program, we've got a website. Certainly looking for connections to any of the veteran resource groups around the state. They've got budgets that now we've got something to go to people and say, hey, if you'd like to invest, if you want to thank a veteran for their service, invest in their smile. And we can do that at $300 a year to sponsor Wisconsin veterans basic dental care.
Wow. I'm kind of surprised that 7 minutes that you've done this a number of times. I can guess that you knew 7 minutes.
I'm just Irish. I got to keep going and keep kissing babies and shaking hands.
So, hey, I've got a couple of questions. And thanks for giving us that overview of Objective Veteran Smile. Is it available only in Wisconsin, then the program and what you're doing only in Wisconsin, or across Delta Dental's like entire coverage area?
It's a great question, but that's again where you start taking a look at things as a business owner, entrepreneur. Again, I've just failed so many times more than anybody else that I think I might have an idea of how to build and scale something no matter what it is. But the reality is Delta Dental is nationwide. There's about 20 different entities of that, and you can start getting into the wonky legal of it. But Delta Dental of Wisconsin is a separate entity from Delta Dental of Iowa, Delta Dental of Illinois, and the various other factors. I think 5 states out west are all one. But that belies the fact that, yes, at this point, we're being very selfish. It's only in the state of Wisconsin. But again, given their network of 5,000 plus dentists, it's very conceivable that, in fact, I just got a couple applications today. It's a one-page enrollment. It's a name, a social security number, where you want things sent, just like you're an employee of any other Wisconsin company. Those apps are received here every day. They're securely sent over to Delta. Delta is doing all of the back end, which doesn't need any on our end. We don't need to have staff. I don't get paid for anything here. I'm volunteering my time. Again, we put about $1 million of our own money in. That's fine. We'll go make more. But now we're looking for people to help pull the rope on this and get more funding, get more connections to not only funding, but certainly the veterans in need. But with 5,000 plus dentists in the state of Wisconsin, all 72 counties and 11 sovereign nations, it should be no more than 20 minutes for a Wisconsin veteran to go to a dentist that carries the Delta name, which is about 90+% of them. So while we're only in Wisconsin now, point B, there's discussion about a couple other states. Believe it or not, Iowa, our good Hawkeye friends over there, they've done a lot of research on veterans and dental oral health. I mean, they've done a massive amount of research. They just don't have a lot of programs yet. Well, maybe this is a solution there. But again, in the state of Wisconsin, for any honorably discharged veteran who's not covered by dental insurance, We want them enrolled in this program at no cost to them, and we'll figure out how to fund it. Now, I also mentioned, and Kathy, thanks for the time this afternoon when we spoke separately, but while many of those folks that are being referred to us, the VA, right? The guys with the printing press are making referrals to the guys who started up. It's okay. But I've got my cards down at the fifth floor dental clinic. And so when that veteran comes in who's 80% disabled, whatever their age, and says, I need to get something done, eligibility, no, I'm sorry, you don't qualify. Instead of being so angry and unfortunately not being able to being able to get care, they can hand them our card. And while that person might need some work that's not covered yet, at least they could get into a basic dental care program, get a dentist relationship, and get something worked up. That dentist could work something up and say, well, they need this, this, and this, and well, you don't cover this. Well, we could figure out through crowdfunding, through maybe VA or American Legions, VFWs, individual donors. I've helped raise a lot of money for St. Jude's. Very similar. Hey, we've got a veteran who needs $12,000 worth of dentures. How can we fund this? We can figure out the money if we find the veteran in need. And the reality is we can start with the basic dental care package for them at no cost through Objective Veteran Smile and our great partners at Delta Dental.
So we've got a question from the chat is, how do veterans sign up for it?
They can give me a ring. They can go to the website to get our number. I mean, I've got if you feel free to send out any of my numbers. I sent you our most recent messaging that we kind of surrounded some things around Flag Day. We've got a website, but they could certainly ping me. We've got a pretty big social media presence on LinkedIn specifically with about 17,000 people out there. Not that I'm any big shakes, but I do a lot of small videos. It's all about up-leveling awareness, right? A lot of veterans, but certainly most civilians have no idea that this is an issue. And to a man or woman, for the last few years that I've been working with it, but particularly now that we're partnered with Delta, they'll say, well, wait a second. Prisoners, incarcerated folks have the better dental package than veterans who serve the country? All true. That doesn't sound right. How can I support? And even veterans. Now, here's what I did for CAS. And I think this is interesting just from a standpoint of all of us that are touching veterans every day or every week, whatever. I didn't think that so many older veterans don't believe this program is true. They don't believe it's a real program. They somehow think that Objective Veteran Smile is part of the VA, which we are in known fact part of it. I've taken cards down and they have our card down there so that if they get a veteran who isn't qualified, which is the vast majority, they certainly could have that person call me, and they do fairly regularly. And we can get them enrolled in the program. And while a lot of those veterans may need more work than what we're covered, at least they could get a basic dental care package, because most of those veterans have not seen a dentist in years. Oh, no, I know I need a denture. I know I need that's okay. What you think you might need to know. Again, I'm no practitioner, but the reality is let's get you set up with a dental relationship, and anywhere in the state of Wisconsin, they'll be able to find a dentist. Now, certainly locally, I've had practitioners start to reach out to me when they hear about the program with some great ideas about, hey, I could make a donation of cash, but you know what? I've also got this skill set. And I also know that if someone needed a $3,000 crown, that's not my cost. That's not Delta Dental cost. If they're part of your program, we could certainly start talking about pro bono, because the servant's heart of most dentist professionals is just, it's terrific. And we're just getting this thing started. And so again, right? Action is what converts the human dream into significance. And once you've tasted significance, and I think this program is all about significance and action, then it's now just about having other folks help pull the rope, make connections, and give ideas to it.
So another question, and Natalie, I think it's from you, but how many enrolled veterans at this point?
We've got just a few under 100 right now.
And
again, that we just kind of soft launched it
since January,
5.5 months ago. Pardon?
Since January?
Yeah, since January. Again, the soft launch for a good reason. I've not done this before. I wanted to make sure, do I need to hire people that are going to be taking calls? No, it's incredibly seamless. We act and look just like any other Wisconsin employer that has Delta Dental for a back-end benefit for their employees. It's the first time it's ever been done. It's a member of a nonprofit. So logistically, it's the same as if an employee benefit was being given to a new employee through HR. They'll enroll with us on the one-page form. Securely, it's sent over to Delta every time we get them. And within 2 weeks, they get a Delta Dental insurance card. that says they're a member of Objective Veteran Smile. Here's their number, and they can go make their appointment at a Delta dentist, which is 90% of the dentists in the state.
And you mentioned that that Delta Dental is doing the back end eligibility or the back end administrative
Yeah, the
stuff.
only eligibility
Is-
is an honorable discharge. And
And
we've got a couple of CVSOs around the state that are really starting they found the program and they're starting to, wow, I just keep this in my back pocket. And every time I've got a veteran, which is quite often. And so what they're doing is they're already checking that CVSO has a relationship. They're seeing, hey, you know what, I've already checked their eligibility. They've got an honorable discharge. At this point, if somebody was, you know, doing something back end and I don't know if they might have been dishonorably discharged, but that's all we ask at this point.
any other questions from anybody else on the line?
And again, anyone can feel free to reach out. I can send you PDFs of not only our program, but what the program covers, the enrollment forms, certainly our CVSOs. I think there was a mailer sent out to most of them after their conference in Green Bay. I wasn't able to make it up there in person, but I know the Columbia County, Rebecca had sent that out. I think we've certainly got it. It's a one-page enrollment. Here's what's covered. Here is what is not. And within 2 weeks, the veteran gets their insurance card.
I do have one question, if I could.
Yes, ma'am.
Does your program yet include family members of veterans or just specifically veterans right now?
At this point, it is only the veteran, not the spouse or the dependents. And I say yet. That's my favorite word in the English language. Yet. Just as our program isn't 100% coverage on everything, not yet. As we get more funding, we can certainly open it up. It's just a matter of funding, as most things are. Our first program, where we went through a lot of money individually, we did have the veteran, the spouse, the dependents. And again, when families are starting to get covered and dental insurance, the dental bills are expensive, just like anything healthcare. That's fine. You learn a few lessons and you pause the program. But now through an insurance company like Delta Dental, it's very sustainable, very scalable. And again, from a donations point, whether that's the Veteran Resource Group or an American Legion or an individual or a foundation or a grant, hey, $300 a year sponsors a Wisconsin veterans basic dental care. How many do you want to sponsor?
Have you heard of Everyone for Veterans, Kyle?
I have not.
The only reason I ask is because they come at this from the same perspective as you do. And I just always wonder how much programs would benefit by communicating with each other so that they're not always relearning the lessons that somebody else has learned.
I'm always happy to collaborate. Right.
Yeah.
I'm not the smartest guy out there. But again, when you put your head down and you focus, right? Everybody else's opinion of this is not mine. Most people would never take this on. And again, not that I'm any big shakes, but the reality is, if it's not us doing this, it's not like the federal government's going to flip a switch and say, hey, you know what? We're going to cover everybody that's 20% disabled and I just don't believe that. That's okay. I don't need to gripe about the system. I can work within the system. Now I just got to go out and raise $100 million, because I think that way you can actually make a dent in that. That's just a number. I could have easily said 100,000. But I know there's tens of thousands of veterans just in the state of Wisconsin who are in need of basic dental care. And by God, I think being put in harm's way as we are every day as veterans, I think we've earned the right to dental care. Just an opinion.
No, I only asked the question because I know that how committed you obviously are to this mission. And
I'm
everyone,
64. I'm just getting started. But, again, you have to have passion for anything you're going to do. But most people have great intention. They never get to an action piece, because in between, that's the Grand Canyon and it's hard work. That's okay. I mean, I'd love to collaborate. I'd love to pick the brain. I'd love to mastermind with anyone else that wants to understand more. And certainly I could understand more and collaborate, because as you know, two heads are better than one. And I'm just a Marine. I mean, you got to speak slow.
well, it's everyoneforveterans.org. They have an extensive website as well.
Everyone from
And
veterans.org. And I'm sorry, I can't see your name. You are?
my name's Connie Walker.
Oh, thanks, Connie. And that's, are they based in Wisconsin, by the way?
I don't believe they are, but they say that they have networks in many states. So I don't know what tentacles they may have in Wisconsin. but their claim to fame is free dental care for veterans and families. And I think they've been in business for some time.
Terrific. Yeah, I'll reach out to them. Thank
Mhm.
you.
The other for Joey, I would have one question for Joey if I could do that, or for Abe or anyone else around the table.
I'll try and answer.
Between entrepreneurial grants and mental health grants, I know what DVA offers every year. Is there any line of thought going to this very important need, Joey, that might work as far as, say, a grant or a grant from any source, community foundation perhaps, is something I'm thinking of.
I think Jeff is going to talk about what we do currently have that the legislature has authorized. That's part of what we're going to talk about a little bit later. As you know, we haven't had great luck getting the legislature to increase, programs, initiatives beyond what's already in current law. So I'm happy to continue this discussion, but yeah, in terms of major new initiatives, I don't know. I'm still new at WDVA, so but I think I know the secretary is trying to figure out a way to make some of those grants, which are underutilized, more usable. So I don't know if that answers the question.
Well, it does. So I hope there's success in that effort. And by the way, I know Rogers Behavioral Health is extremely grateful for the focus you put on their grant. So
I'll
think
just say
just-
one thing there too. And again, I don't know who's on the network, but I did, have an initial meeting with the Wisconsin Department of Veterans Affairs, sit down actually with Jeremy just a couple of weeks ago. Again, just we spoke to WDVA. I think Jeff Darby and I have spoke with a couple other people over the last few years. Nothing came of that, but that's fine. I mean, now we've actually got a very scalable, sustainable program. But Jeremy started to have a couple of great ideas, and so at least some folks now at WDVA are aware of, hey, this is out there. So all we'd like is, hey, a shout out going, hey, maybe, this grant's coming up. Maybe at some point, you can find somebody that can, put your mission. I don't know how to write the grants, but I got a couple of people who are waving their hands saying, hey, when you find something, we'll certainly help align your mission to that. And, the more the merrier. So.
Yeah, I want to be clear. We don't have we have two very specific health care grants that are, because of when they were put in statute, the criteria to be eligible to use them is makes them almost impossible to use. So in
That would
terms
make
of
sense.
so in terms of being able to use any of the grants we have for that kind of health care probably would take legislative action. So
I'm happy to go battle with anybody. Yeah,
we
they don't
need a
want to see me
lot.
come.
Yeah.
Any other questions or comment? Well, I do have a question, and it's not for Kyle, but it's Joey, kind of a follow on. And that's the department, WDVA used to have a grant for nonprofit organizations. Just kind of the general nonprofit organizations. Is that still a grant that the WDVA offers?
We do have, Kathy, it's Jeff. We do have the nonprofit. We do still offer that. But it's the more the grant at the department that we have that I'm going to speak about is the healthcare grant, and I can give the ins and outs on that. And that's the one that's really is related to dental care. And as Joey said, and as you know, you served with us, there was a lot of restrictions on that. But I can get into some more understanding for everyone when it's, my time. That's perfectly fine. I would not recommend specifically just the nonprofit for dental care. If someone comes to the WDVA, they're going to want to try to apply for the healthcare grant, but they have to meet those certain requirements that I'll go through just fine.
Yeah, and I was thinking more along the lines of, and I guess I didn't cover this, and I'm not sure that Kyle mentioned it, but assuming that an organization like Kyle's, if it is a nonprofit organization or
Sure.
organized as a 501c3,
Yep.
that might be a grant in the future that they can keep their eyes out for when the application
They
period
can,
opens up.
of course, on our website on the grants page, and we're moving more towards an electronic platform, trying to make it more efficient for our grants, which is yay.
Yeah.
And
We'll look for that announcement too, so that
yes,
we can share that throughout the entire VetsCAN network.
that would be great. We are working very hard on that actually to make that go through. You know, we do have an electronic platform now, but we're even looking at to make it even better in the future to make it more efficient. As you know, for a long time there, it was paper and pen or just PDFs, and that's kind of the thing of the past. I read that somewhere now.
Yeah. Yeah, what year is this?
Yeah,
Which century?
but we have done, the department has done a good job, especially in the grants within the last couple of years to make it more efficient. I can get into that, that's fine. But if, to answer your question in summary, if someone wants to apply a nonprofit, as long as they meet, you know, especially a 501c3, they can apply. It doesn't hurt to apply. The worst that can be told is no.
All right. Thanks, Jeff.
Yep.
Any other questions for Kyle? Questions or comments about Kyle's presentation? If you're in the chat, I did place the URL for Objective Veteran Smile in the chat. That's objectiveveteransmile.org. So anybody can grab that from there.
Can we get an email address for you, Kyle? Or is that on your website if we have other?
Yeah, it should be on the website, but I forget the long version of the Objective Veteran Smile, but my personal one is pretty easy. K Arneson, Karneson, K Arneson and the number 2, Karneson2 @gmail.com.
Thanks so much.
Kyle Arneson. Yeah, much appreciate the time, folks.
All right. Thanks so much, Kyle.
Thank you, Kat.
Okay, so we can move on to, I said we would go after Kyle, we would be followed by the round robin updates. So, Abe, are you able to give us an update today from the hospital or regarding the hospital?
Sure, I can do that, Kathy, and I'm going to save you guys all from my picture because I am recovering from an illness here at home. But we do have a couple of exciting things. First, last week, usually we talk about things in the future, but I just wanted to comment on one thing from the past. We did induct our first female veteran into our Hall of Heroes. That's been something we've been wanting to do for a long time, and Lieutenant Marcia Gates was our first woman on the wall. So we had a really great ceremony. I think we had over 100 people at the ceremony last week, and we had some nice press coverage. And it was really just a great way of celebrating Women Veterans Recognition Day here at the hospital. So looking forward, we also have a couple of very exciting events coming up. Next week on Thursday afternoon, we will be doing a ribbon cutting for our Baraboo community-based outpatient clinic. So that ribbon cutting will be followed by activation of the clinic that next Monday on July 1st. And then on July 2nd, we'll be doing a ribbon cutting for our major East Clinic activation. And that clinic will formally activate on July 10th. So those two items that we've been talking about for, I think, many, many months, and in some case years, are coming to fruition, and we couldn't be more excited to be able to offer them to the community and to veterans in our area. So those are really our two main items to report out, or our 3 main items to report out. If anyone has any questions about those or anything going on at our hospital, I'd be happy to answer them.
Thanks, Abe. Any movement or progress regarding the Fisher House?
Sure. We're in the stage right now where there's a lot of behind the scenes negotiations and paperwork going on. So as you can imagine, in the federal bureaucracy, there's quite a bit of vetting that has to happen, and documents that need to be signed and due diligence that needs to be done. And we're really right in the middle of that. The progress is slower than any of us would want it to be, but it is moving along deliberately. But I don't have a clear date. We are doing due diligence on a few properties. But it's hard to speculate on, when that will come to fruition, just given all of the things that, could go right or wrong in those negotiations. So what I would say is we're making good progress. All of the people who are involved in the project are committed to getting it done as quickly as possible, but it is likely still going to be a little bit before we have news on a property and a purchase of land.
Okay, all right, thanks for that, Abe.
You're
Any-
welcome.
Any other questions for Abe? Anyone? All right, it's out. Abe, we're letting you off easy, I guess.
Well,
It's 'cause you
I
don't
will
feel
stay.
well.
I will stay on unless if something comes up. And I'm definitely interested to listen to the rest. That was an interesting initial presentation, so I was happy to be on to hear that.
Thanks, Abe. Okay, so Joey, we're to you. We're happy to hear about what's going on at WDVA.
Okay, I'll give you our update. The first is the issue that gets talked about a lot, the master plan. Uh, and there was a lot of confusion about what that was or wasn't or is or isn't. And the legislature proposed two, well, the governor also, two different studies. The governor proposed one was on King specifically, and one was on nursing state. As a result of what the legislature passed and the governor's veto, we came up with one called the master plan study. And it's not a actual master plan, which I think some people were expecting, and it's certainly not a master plan for King. So there's a lot of misconception out there, but what it is it's a study to gather information that will help us prepare a long-term master plan for nursing home care for all veterans in the state, moving forward. So what we are in the final stages of signing a contract with a consultant who will be doing a sort of demographics study along with a workforce study and a deep dive into nursing home care in general across the state. The report is due to be finished by January 1st when we're supposed to submit that to the legislature. I will share it with Kathy and you guys can see it when it's done. But mainly it's going to be a lot of demographic and workforce study information about so that we can then make intelligent decisions about what way to move forward. Nursing home care, and I could talk for hours on it, but I won't. Over the last 10 years, the industry as a whole has undergone tremendous struggles, and our homes in general have lost a significant number of the population. The VA used to require, if you wanted nursing home care, to go to one of the three homes. And now, over the course of the last 10 years or plus, they have contracted with private nursing homes across the state. So in order to get your care covered, you don't have to up and move to King, Chippewa Falls, or Union Grove. You can go to the nursing home down the street. The other big change is that we used to be able to take spouses when a veteran needed health care, we could take a spouse along with them. But once the funding dried up from the feds and we became officially skilled nursing facilities, you can no longer admit a spouse who doesn't also need skilled medical care. So people are much less willing to move to Chippewa Falls if one member of a spouse, a team. So we've gone from 700 to under 300, and the long-term prognosis is not good for those numbers ever rebounding, and I'm not even sure we'll be able to maintain those numbers, given we don't have a high demand at this point, and we're having terrible time finding people to work in our homes. It's not just our homes, but all nursing homes. So But that master plan study material will be ready, and we'll share it with you. Many of you may, we've asked the consultant to reach out to community groups and veterans groups, so you may be hearing from them directly, because we want them to talk directly with people about what their conceptions are and what their feelings are about nursing home care and what should or shouldn't be provided. So you may be hearing from this consultant separate than through us. Part of their charge is to talk directly with stakeholders across the state. So that's the master plan update. The other big part of what we're doing right now, and Kathy will remember this, is we're doing budget. We're doing all the work to get ready to submit
Joey,
to the
Joey,
governor, and then through that's a big part of what the department is working on right now. Site. Yes.
can you, the reception is not great. Can you try, turning off your video and seeing if we can hear you better?
Oh, sorry.
Maybe that'll help.
Is that better?
Yeah, seemingly so.
Okay.
So I understand, like, budget, working on the budget.
Yep.
Is there anything significant in there that that you're able to share as far as requests or intended requests?
Not yet in the process. Yeah,
Okay.
That'll come, and we'll share that as we get farther along in the process.
And on the regarding the master plan study,
Yep.
I missed if you did say kind of what the timeline is for completion of that study.
Yeah, the legislature required us to finish that by January 1st, 2025.
Oh, okay. And
Joey,
that,
if I could also ask a question about that master plan, Kathy, were you through?
no, go ahead, Connie.
Okay. Long ago, when John Skokos was the secretary, so you know how long ago that was, he mentioned at that time strategizing a way to bring post 9/11 veterans in to nursing home care who needed it when their caregivers aged out or something happened to the nuclear family where a family caregiver could no longer do what they needed to do. I thought, for that piece of what he talked about, I thought that was pretty forward thinking, because this is a cohort of veterans who's with us for a long time. Is there any conversation around these demographic studies and the workforce study that focuses on that piece?
I'm not sure exactly what they're going to do is look at the people who need skilled nursing care. That's, and I don't know if that fits what you're talking about, but this right now the 3 homes are skilled nursing facilities, and they're overseen and regulated by both the state and the federal government. And so if it's someone that might need that kind of care, the consultant will be looking at those. It's not just elderly people. It's we have some dementia care. So people who are much younger, we have some beds for that, for veterans. So depending on what specifically you were asking about, my guess is they would be a part of that, what the consultant looks at.
Mm-hmm. I appreciate hearing that, because as you say, I think the general way of looking at skilled nursing care is for folks to consider a geriatric population, and that doesn't include post 9/11 injured veterans. Or for that matter, Persian Gulf War. So as numbers are gathered for the state of Wisconsin of disabled veterans who need this kind of help, I hope it's, as you say, age is not an implied barrier to that study.
No, we've already talked about that, because there's also some traumatic brain injury stuff that is not, often people don't need the skilled nursing care for the rest of their lives, but need it for a certain amount of time, is what I'm told. So yeah, we're going to be looking at anybody and everybody who might need a skilled nursing facility, any veteran. But again, we're facing the same thing. When if VA would pay for that at your local nursing home, is it realistic to expect that someone's going to move to King to get that care? You know what I'm saying?
Just one last tiny thought. Thanks for your patience with me.
Yeah.
The other thing that I've learned is that for those of us who are working with veterans who have psychiatric or mental health issues, and TBI can mimic mental health issues in many ways, PTSD, diagnosis of a serious mental illness, skilled nursing facilities don't take those on board. And that's, given post 9/11 generation vets, what we know about the suicide rates currently, that particular aspect of care is no less important than any other aspect of physical care. And so I get mental health care in terms of workforce staffing as a problem across the nation. Not, and I don't know how comfortable VA mental health care staffing is at this point. I suspect it's probably more comfortable than in the civilian sector. But anyway, I just wanted to raise that point because as I understand it at this point, those folks can't turn to a skilled nursing facility. And the need there is also quite great. Thanks for letting me add that.
Yeah, and I do apologize for the spotty reception. But I wanted to give one more update that is more on a positive note from WDVA. As you may remember, the legislature set aside $9 million to purchase the building that the Veterans Museum is housed in. They put that in the budget, and we are now moving forward. We're going to go before the State Building Commission probably in August to ask for permission to actually spend that $9 million. And once the Building Commission gives us that approval, hopefully we will be moving forward with, a long dreamed about plan to update and make this the proper home for the veterans' stories that we have. So looking forward to making some progress on that front.
Do you have a number on the capital campaign need?
Sorry, I don't. The Museum Foundation, which is a legally separate group from us, is handling the fundraising part for now. Until we have till we go back to the Building Commission with a real plan and a budget. But at one point, I know they wanted to raise at least $40 or $50 million, and they've already gotten a number of promissory notes from people like Jerry Fauci, and that's the only one I'm sure of off the top of my head, but they're working hard on trying to raise the capital we'd need to build this new facility.
Mm-hmm. Thanks so much.
You're welcome. Any other questions?
Yeah, this is Kathy again, not a question, but just kind of a comment and let you know that, Joey, I've been thinking about DVA and just kind of the team over there as I've tried to stay somewhat up to date about just, nursing homes and long-term care in general. And I think, that with the knowing where that the state veterans population, our demographics, where that population in general is on the decline. I've wondered about the staffing issues and, and just changes in policy at the upper levels when it comes to both, the VA and Medicare policies that affect the veterans' homes. Just know that I've been thinking about you. So thanks. I think we will be looking forward to if we're able to provide any insights or input for the consultant study, but certainly seeing the output from the consultants related to the homes. It's such an important resource. And I think, as Connie touched on, it's like some of the initiatives or ideas that were discussed, 10 years ago, 15 years ago, that didn't come to fruition. And, hopefully, some of the creative solutions are at least being, maybe the dust blown off of them or being looked at as far as, if the entire model, and I don't know if that will be looked at by the consultants, if the consultant in that master plan study, if they'll be looking at any sort of alternatives. Well, is it, are the veterans homes going to be exclusively long-term care? Could the King campus be transitioned to something that is partially long-term care, but then partially other? It's, I think, at least one or probably a couple of the most recent former secretaries talked about in one way or another, kind of a continuum of care model, especially at King, and because of all of the different resources and the location of that campus. And, but anyways.
Yeah, I, I will jump in because the reality is that those continuum of care options are extremely expensive. And as you know, with the past hat you had on, the legislature has not been very receptive to investing state dollars, GPR dollars, and many of you may not know this, but up until this point, the legislature has not put a single GPR dollar into the nursing homes. In fact, for many years, they took money out of the nursing homes and use it for other veterans issues and for other things. So we want to look at every option, but we also have to be realistic about what we how and when, and how that would get paid for if we were to try and figure out to do some of those things. So no stone unturned.
Yeah. All right. Well, thanks so much, Joey. Last call for any questions for Joey. All right, I'm seeing none. So thanks, Joey. We will now move on. I haven't seen Dr. Sabino join us yet. So let's see. Do we have any updates from around the room? And Dan, you're the sole CVSO on with us. Do you have anything out of Dane County?
Yeah, I'll provide an update and then I have to jump off. I have someone that came in that I have to see here. One of the things, so my name is Dan Connery from the Dane County Veterans Service Office here. I can just speak to our office. We're continue to be very busy. Our appointments are booking out almost to September right now for services here. As I say every time, we triage and we don't just let people hanging, but we're very busy. And there's only so many hours in a day, so we're trying to keep afloat. We have 2 brand new people that started on Monday, so we're busy with training. It's just very busy. We are still feeling the effects of the PACT Act and the workload that has come from that, both for our veterans and surviving spouses that are eligible for benefits. And quite frankly, I think systemically, the system is going to be feeling this for decades to come, with a lot of the conditions that are related to both the burn pit and other toxic exposures and the adjustments to the Agent Orange presumptive. So that those things are really keeping us busy and others like us throughout the state and around the nation, I'm sure. Thankfully, I think the word is getting out more, but we still it takes a village. There are still many veterans and survivors and others out there that are unaware of benefits. So we try to get the word out as much as humanly possible, but I mean, like many of us, it's that we don't have big advertising budgets or anything like that. So we really need to try to get the word out. Sometimes people are guilty of excluding themselves, thinking they're not eligible for benefits. And I know for a fact there are thousands and thousands and thousands of people eligible out there still. just in the state of Wisconsin, let alone nationally. So the more we can kind of, get on our, get on our wagon or whatever you want to call it, get on the horse and get the word out, the better. I just wanted to mention one of the things you guys talk about long-term care. And this may be a good person to have on. There's a veteran directed care, or VDC. It's a relatively new program through the VA Health Administration. There's a social worker at the VA hospital that can talk about this, but it's basically where if someone needs help with activities of daily living and has a certain level of need, if they qualify, the VA can pay a family member to that person, or to the family member can be paid by that person from funds that are given to them from the VA, and that can help that family member stay, or that veteran stay in their home versus having to go to a facility. We know that whether it's King or a local nursing home or assisted living facilities, there's the demand far surpasses the space available in many cases. So if we can, it takes a village. So if there's a way to keep people in their homes and safely in their homes, that is, and if there's a resource such as veteran directed care, that could be advantageous for people. I can put in the chat, I can put a little link on veteran directed care.
Thanks for bringing that up, Dan, because I think somebody mentioned that, maybe I'm thinking like back around the first of the year at one of our meetings, this was brought up maybe, and it was just getting started. And so thanks for bringing that up. And I think that we'll want to share that and help spread the word on that some more.
Yeah, and I'm going to talk to the social worker actually tomorrow, probably tomorrow or Friday, about the social worker that sort of champions that program right now. And I can mention that it may be good for her to connect with you, Kathy, as far as being a speaker or, kind of a presenter. Because this is kind of a game changer for a lot of people. We have, I know a couple of my clients have family members that are being paid now to help take care of them for, and provide some services. And not only does it provide a little financial relief to that person, that individual, that family member, but then it helps. In this case, it's the one case for sure that I know of. It's her father is in need of services, and she can work less to help take care of him. It's a little bit different than the caregiver support program, but they're kind of like kissing cousins, maybe.
Okay. You know what? And that's what I think, now that you mentioned the caregiver support program, I think maybe that's what I'm thinking of. So.
Right.
But.
And then, the VA, I think, is kudos to the VA, federal VA and state VA, of course, everybody, but they really seem to try to be cutting edge and innovative about trying to be proactive with these things. Because, you think of our Vietnam veterans, which is our largest remaining veteran population. Many of them, of those that remain, are at the point where they need that help with activities of daily living and long-term care, or will be coming up on that soon enough. So, and we're talking, a substantial need. And so systemically, if we can come up with a way to meet that need, that's a good thing for our people. So.
Yeah, thanks. Dan, we've got a question in the chat for you.
Yes.
From Jess. Jess, I don't know. Jess, do you want to just go ahead and ask?
I see the question now.
Okay.
Had a veteran ask about Agent Orange presumptive, including or not including high blood pressure. He said this can. So what we're seeing, Agent Orange, hypertension or high blood pressure was added as on August 10th of 2022 with the PACT Act. Hypertension was added as one of the presumptive conditions. The overwhelming majority of those individuals that have been granted service connection for hypertension in relation to that person's exposure to Agent Orange, most of them are being granted 0% service connection. and I'm not sure, Jess, you can chime in if I'm not getting to your point, but they're getting granted 0%. So with that, they are, that individual condition isn't necessarily, wouldn't be at a compensable rate where there's no monthly compensation. However, hypertension can cause a whole host of other medical issues as well. So we've had several just in our office, maybe half dozen to a dozen veterans to get granted dementia secondary to their hypertension, kidney disease secondary to hypertension, and a number of other ailments as well. So it feels like for a lot of our veterans, through working with them, they sometimes feel a little defeated or a little turned off by the fact that maybe they're being granted 0% for that hypertension condition and it's not resulting in compensation. And certainly we don't want them to have other health issues. However, should they have those other health issues, or, obviously if a veteran passes away and hypertension is listed as a contributing factor to death, to their cause of death on their death certificate, now that surviving spouse is eligible to file for a benefit as well. So there are, I'm not sure if Jess is if that's what she's referring to, but it's really about educating the clients that we're serving and making sure that we're setting expectations and that they're fully aware of those challenges. But classic example of a condition that the secondary issues generally far surpasses the primary rating is type 2 diabetes in relation to Agent Orange exposure. Diabetes may be a 20% rating if it's controlled by metformin or insulin, but their secondary issues are can far outweigh that primary rating. And again, it's really if we're being good stewards of the process, it's good if we can be transparent and be very, good stewards of explaining how things work and making sure they understand when it goes into that. So as Jess just said, she said, thanks for explaining this. We try to tell them more than likely your rating is going to be a 0%. But if you have any other secondary issues, then we can claim those. It doesn't always sit well with people because they don't want to get just a 0%, if you will. But we still have to work within the confines of the system. I know that's a very long explanation, but that's it.
Thanks, Dan.
You're welcome.
Thanks. Any other questions for Dan? All right, it looks like.
And I apologize, Kathy. If I have to jump off, we have some people that came that are unexpectedly here and I need to meet with them. I thank you for everything that you do, and I'm going to try to be more visible here on future meetings. But as you know,
we can understand how busy you are and all the staff in you. So, and I hope the 2 new staff that you've got are 2 additional and not just filling vacancies that you hope. I hope that
sort of a combination.
Okay.
But we're busier, or we're fully staffed right now, which is is the good thing. And it's just going to take a little while to get everybody up to speed. There's a pretty steep learning curve in this job. But I would subjectively argue there's no place better to learn it because we're very busy here and there's a lot of good examples and we have a lot of good people already. So,
and you're doing great work, and just keep it up and don't let anything happen to you. So
thank you. All right, sorry to jump off now, but I'm gonna probably just shut my camera off because I'll probably be back, but I gotta go talk to these people right now. Thank you, everyone.
Right. Thanks, Dan. Okay, so I see that we don't have Dr. Sabino yet. So is there anybody else before we move on to Jeff, who's waiting patiently? Anybody else on the line have any updates from their organization? All right, I'm not seeing anybody. So Jeff, tell us about your healthcare aid grant.
All right. How you doing, Kathy? Long time no see.
It's great to see you again.
I know. It's been a little bit. I'm gonna blank my camera out just because it's been a little spotty for me as well while I talk. Here we go. All right, as everyone knows, the WDVA does have a grant, specifically the healthcare aid grant that does cover some dental work. As we covered, there are a lot of restrictions, but I will go through the highlights, and then after I'm done, I will put in some direct links. I'll put in our link to our website, to the page where these links, these documents are at, and then I'll further it up with direct links. So if someone wants to bookmark it, they can do that. But, you know, just going through it, first things first, to be eligible, one of the basic requirements are veteran has to meet the Wisconsin definition of 45.01 sub 12. That is kind of like our holy grail around our chapter 45 benefits. It is eligible for unremarried widows and dependents of service members who died on active duty in the line of duty and whose household income, this is a big one, and I'll explain it further in a little bit. The household income does not exceed 200% of the federal poverty guidelines. Now, before I go any further, a lot of people are like, well, when we try to explain this, what the heck does that mean? And they look at us with like 3 heads coming out of my neck. We take that a step further, and we post a bulletin every year with these guidelines. So someone can easily see what we're talking about there. Families of deployed, activated service members who have lost income due to the deployment / activation have suffered an economic emergency. Now, let's get into more specifics about the dental. Those are some of the basic ones. There is a lifetime cap of $7,500 for this grant. 2 types of aid dental care. There's initial dental care and then extended dental care. All right, so for dental care, someone can only receive $800 in any consecutive 12-month period. Extended dental care, someone can receive $4,000 in any consecutive 24-month period, so aka $2,000 in any consecutive 12-month period, if you're just looking at it from an annual standpoint. Big question that we do get is, well, has anybody, or has there been talks about going beyond that lifetime maximum of 7,500? And the question is, as Joey alluded to, I did, Kathy, as you know, this grant is governed by the legislator pretty heavily, but from what I understand, and I've seen how the department has done this, when they do raise that amount, because at times they do raise the lifetime maximum, someone will get the difference. So let's say someone reached their lifetime maximum of $7,500, and in 2 years from now, the legislator raises it to $10,000. All right, for the lifetime maximum, they will get the difference. So you take 10,000 minus 7,500, and if they're applying for more dental care, they'll get that difference. They won't get an additional 7,500. That has just been the precedent since what the department has done on that. Some other things that I'd like to point out is there's always questions around, types of income and everything like that. We take in consideration the earned income and unearned income. So earned income meaning if a veteran or the survived unremarried widow has a job, we look at their income. We take paychecks, pay stubs, things like that. The unearned income is service-connected disability, pension, child support, etc., things like that. And we're looking at 30 days worth, because another question we get are, well, are you looking at like 5 years worth, 2 years? It's 30 days worth of income. Before I go any further, is everyone following me so far? I always because I know these grants can be kind of crazy, and there's a lot that goes into it. Before I go any further, everyone with me so far?
Jeff, do you happen to have the figure, like for the current year, what is 200% of the federal poverty level.
Good question. I do have it pulled up, and what I will do is I will put it in. Well, here, I'll just share my screen if I can. Let me see here. Sorry. All right. Can everyone see my screen?
No. And
Should be coming. What about now?
yes,
Okay, this is the bulletin I was talking about right here. So when we collect all of the income, so let's say it's just the veteran applying, they have to have an annual it cannot exceed this amount right here. 30,120 monthly amount, if you're looking at it, 2,510. So this would be an example of just the veteran, so one person. Now, if there's two people in the household, this is the income limit annually, monthly, and so on and so forth. Okay, now another question, a lot of questions revolve around, well, what is considered a dependent? What's considered a household? Let's go through all those. Household is the veteran, spouse, and dependent. Okay. A spouse, they have to be legally married with a marriage certificate, separated. Now we get this a lot. Well, what happens if my spouse and I are just separated? We're not living together. They have to have legal if that's the truth, we have to see a legal separation document issued through the court system. Dependent, that is anyone under the age of 18. Another big question is, well, what about dependents over 18? 18 to 26, where a dependent can be, but they must be attending some sort of post-secondary education, like being enrolled at UW-Madison, MATC, any type of trade school. Now there's not the department has never defined, well, it has to be at least 6 credit hours, has to be at least 10, whatever. Just as long as they're enrolled in at least one class for a dependent between the ages of 18 to 26, they meet that requirement. Okay. Let's talk about some of the coverages, because we get that question a lot. Dental care and all dental care and procedures that are required or necessary. So anything such as you need a cavity filling, root canal, cleanings, x-rays, dentures, implants, surgeries, etc. Big thing that I like to point out when I'm discussing these grants with folks is if someone just wants a gold tooth, platinum teeth, whatever as a cosmetic, these grants will not cover that. They will not cover that. They are for required or necessary. Another big thing is a lot of times people will get questions around, well, what about, do you keep a list of the providers for this? And the answer is no, because all the providers are, it's up to the veteran to go to the dental provider and see if they will accept this type of grant. Because every provider, as we know, is different. It's not
is that an issue, Jeff, that,
we have seen that, but it's not too much, because I'll be completely upfront. A lot of times before we even get to that stage, folks are disqualified because they don't meet the requirement. Because one of the big thing is the asset requirement. Now, I haven't even said that, this is the bigger one. You cannot have more than a liquid asset value. You cannot have more than $1,000 in your account, combined household. And that covers everybody, the veteran and the spouse. This is something that, like Joey alluded to, that we're working hard as the department. We're trying to get it changed, but it is up to the legislator to update that. And Kathy, you know how hard that can be sometimes. So they have to have it's still written in statute, a combined liquid asset value of 1,000. If they're over that, they're disqualified. That is a big kicker on these grants, which can be difficult. Does that make sense?
Kind of a.
What's that?
I understand what you're saying, but no, it doesn't make sense.
I know, well, meaning like, well, when I say, I know, I know what you're getting at, but sometimes people ask, when I say, I should have clarified, when I ask that, because people start saying, well, what do you mean by liquid assets? That's how I should have said it.
So,
That's a combination, go ahead, sorry, go ahead.
so I guess in the interest of time, because we just have a few
Yep.
minutes or a couple minutes left, and I'm sorry that.
No, it's okay.
You know, you're left with not a lot of time, but are there some veterans out there that are able to obtain this grant? And I'll give you a couple of questions at once.
Sure.
What is the application process? Is this an application or a grant that has to be applied for through a CVSO?
Yep.
And then
No, but I'll get into
third-
the explanation, go ahead.
third question is there anything, or what can VetsCAN do? VetsCAN, like our whole partnership, our whole umbrella, is there anything that VetsCAN can do to help address this issue, or I don't know, be a force for getting things changed so that this grant can be better utilized?
Well, it's a good question. I would say really is just the educational portion on this, and I'll provide those documents, and then, like any notes that you took from the meeting today, because that's the biggest kind of hurdle. I don't know, and Joey could speak more on this. I doubt there's anything that you can do directly to the legislator, because you know how they work. Is just really is the educational side of things. That's how I can answer that. But, going back to my, how I said liquid assets, checking, savings, and money market accounts is what the department looks at. A lot of time we don't go anything past that. We don't get into certain stock evaluations and all that jazz. It's just your basic accounts that hold liquid assets, such as your checkings, your savings, and your money market accounts. And that includes, like I said, the veterans and the spouses. We do 30 days worth of that. Now, another big thing is we are the payer of last resorts for this grant. This is another thing that is tough to get folks to be able to utilize this. Is a veteran has to exceed all of their other aid beforehand. They have to exceed all of their other state aid, federal aid, county aid, everything like that before we can issue one of these grants. And they do have to get a letter, they call it a NOD for short, notice of decision letter, through their prospective county consortium. That shows that they've applied for Medicaid or Badger Care. Now, there is some caveat to that, because we've had issues in the past, and for the department to try to work with the veteran as much as possible. The requirement for like the Medicaid / Badger Care through the county consortium can be waived if the applicant submits evidence that no providers within their prospective county will accept new patients using Medicaid or Badger Care. That does help once in a while. Does it help all the time? No, but that is something the department has done to try to help that. I just like to put that in there because that does come up on a regular basis, questions like that. But that is what these grants are in a nutshell. Any questions? Clear as mud, right? No, it's really for dental care. We do have some but it's really a grant that is designed, as everyone is intelligent on this call can see after explaining it, it's really a grant that was designed to be the absolute payer of last resort. Now, everyone has their own thoughts on that, but I'm just gonna leave it at that. That's how they designed it. And we're stuck with it at this point.
Well, thanks for the presentation, Jeff, and
Sure.
just so and I didn't catch, did you say yes or no regarding, is this a grant that has to be applied to through the CVSO?
No, they can apply through a CVSO, or they can apply directly to us. The application is on, and I'll put it in the chat, everything that I said. It's just a fillable PDF if they want to apply by themselves. It's pretty straightforward, and then they can email it into our grants unit inbox. I'll put that in there as well. And the application includes something that I didn't mention in there, a declaration of aid. That is needed for the application. A lot of times, I don't know why, but folks overlook that or don't fill that out. But that is a vital part. That's like your lettuce on a hamburger. You know, that's if you like that. If you like lettuce on a, but or like if you're gonna eat a hamburger with a bun, it's one of your buns. Well, maybe better analogy. That is because that really gets into the specifics of the incomes and all the different types. And it's pretty straightforward. I will say, can you fill it out in 2 minutes? No, you have to take some time and go through it and fill it out and submit it. But that's required. So we need the application, declaration of aid completed, and then the notice of decision letter. And then any other supporting documents that the application says to submit, which it's very clear on there. But CVSOs have submitted them. If they do have any questions, you remember Chad McCafferty, I'm sure, don't you, Kathy? He's still there. They
Oh,
give
yeah.
Chad a call, or myself, mostly Chad, and Chad will walk through and, you know, give that one-on-one attention if needed.
Great. And yeah, if you could drop that information or links in the chat, and
Sure.
if you're not able to do that quickly before we wrap up,
Yep,
if
I
you
can
could just
do it.
send those to me too, we can include that information
Yep,
in our follow-up newsletter
sure.
that goes out, and post that on our website as well.
I'm putting them in now, and I'll send you, we'll do this too, Kathy. I'll send you an email with it too, so you have it in 2 spots. So you know, you have it, so you don't have to
Okay.
refer back to the old chat.
Perfect. And of course, if anyone has any questions, they can reach you, Jeff,
Yep.
is it correct? At 1-800-WIS-VETS?
That is correct. Yes, that number, and it'll get a contact with one of my team members. And if it's anything that they or Chad or Leslie can't answer at BBRC or grants, you know, I always follow up, or they know how to get it into the right hands of the right people. Because as Mr. Connery alluded, PACT Act, we've felt that too with the calls, you know, just veterans calling in, just general questions. And so I definitely feel where he's talking about on that, just like everybody. Which I'm glad veterans are calling in too. But we have seen a huge uptick in calls and services and things like that. So,
Well, thanks for everything that you and your team are doing over there
you're
and
very
handling
welcome.
all those applications and answering those questions and getting veterans connected
Oh,
to
sure.
resources and services. Like, yeah, like Dan said, that's just this ongoing challenge.
Oh, yeah. And it's gonna be, like he said, this is
Yeah.
gonna be decades to come, and I completely agree.
We're all in it together.
Yeah. Yeah. There is a ripple effect.
So, thanks, Jeff. I'm gonna share here's our, if you can see the screen, share, ways that you can stay in touch with VetsCAN. If I would ask that you add our email info@vetscan-wi.org to your safe sender list, or your anti-spam list, or your whatever it's called in your email platform. because we know that sometimes our newsletter can get hung up in those spam trackers and be misdirected to your spam folders. So to ensure that our monthly newsletter arrives in your inbox, please add us to your safe senders list. Follow us on Facebook and LinkedIn, where we try to do regular postings. And I think with everything that we do, we try to do it with, moderation is the key. So we're not trying to be annoying. So, so
No problem.
let's see, I'm gonna take a look at the chat. And make sure that, all right, we've got information from Jeff. Take a look at the chat. Otherwise, check out our next newsletter. Will include a wrap up of this session. Thank you for joining us today. We will be off. We're taking July and August off, and we will be back at it in September, and we hope to see everyone then. Thank you, everybody.
Good. Thanks,
Thank-
Kathy. Thank you, everyone. Bye-bye.
Thanks. Bye.
Bye.
Ah.